Rabies shared the message save a life. Rabies, rabies, hydrophobia, Liza, rage, tolerant. Rhabdovirus enveloped single-stranded RNA enveloped virus, bullet shaped with 6-7 nanometer spike projection. Negative standard RNA coded for 5 proteins GMNLS. Virus may persist up to 18 days at incubation site. Virus travel 3 mm per hour. Serotype, host, geographical occurrence, classical rabies, Loges bat virus, macaca virus, Duvenhage virus, European bat Legia virus 1 and 2, Australian bat Legia virus ABLV. Legia virus host animal found around the world. 87 countries contain rabies, but more cases are reported in Asia. The virus shaped somewhat like a bullet. History of the virus. History of the virus. Man described the disease in 2300 BC. The origin Rabies, meaning to do violence, come from ancient Indian Sanskrit dating 3000 BC. History of the virus. History of the virus. Outbreak of rabies in Europe in 20th century spawned the vampire myth linked to bat. Rabies epidemic in 13th century France may have spread werewolf myth as well linked to wolf. Rabies is commonly spread by bats and wolves and other wildlife, foxes. History of the virus. Since Roman time, man established the link between the infectivity of a rabid dog's saliva and the spread of the disease. Because there is no cure for rabies, those that had been bitten by a rabid dog would commonly commit suicide to avoid the painful death that would inevitably follow. History of the virus. Louis Pasteur was the first person to diagnose that rabies targeted the CNS. Also determined that nervous tissue of an infected human or animal also contained the virus. In 1890, created the rabies vaccine and saved 90-year-old Joseph Mister after he had been bite a rabid dog. World Rabies Day September 28, 28 September also marked the anniversary of Louis Pasteur's death. Epidemiology of rabies, urban cycle, salvific cycle, domiciliary cycle. Virus incubated, virus replication in muscle, skeletal muscle, virus bind to nicotinic acetylcholine receptor at neuromuscular junction, virus travel within axon in peripheral nervous via retrograde fast axonal transport, displacement motor neuron of spinal cord and local dorsal root ganglia and rapid ascent to brain. Infection brain neuron with neuronal dysfunction. 7. Centrifugals spread along nerve to saliva gland, skin, cornea and other organ. Clinical forms of rabies: encephalitis furious 80%, paralytic dump 20%. The rabies infection and the symptom that accompany it is classified by 5 stages. Incubation 1 to 3 months, prodromal where first symptom occurs, acute neurological phase, coma, death or recovery. Infection, feverish, short throat, loss of appetite, burning pain ulcer, reaction to glare and loud noises, difficulty swallowing, chorea, unconsciousness, diet. Human rabies case presentation. Human rabies case presentation. Human mortality from endemic area estimate 30,000 to 55,000 deaths per year. Half of the global human population live in canine rabies endemic area. WHO. Economic impact 96% of cases due to bite of dog 80 billion. 3 to 3.5 million take posture exposure vaccine. Economic cost due to rabies in Asia. Livestock losses, rabies incident rate, leg cattle, annual number of cattle dead 21,000. Dogs are the principal reservoir of rabies. Cat, wolf, jackal, mangoes, and monkey are other important reservoirs of rabies in India. Bat, rodent, and squirrel has not been reported from India, transmitted mainly through the bite from infected animal. Wound contamination through infected material like saliva or infected nervous tissue. Aerosol infection in bat infected calves. Virus circulate in a wide variety of wild animals, which are the potent source of being reservoir. Human to human, possible mainly through corneal transplant. In death animal, virus become inactivated during autolysis. In winter or refrigeration, virus remain for several months in cadaver. From milk, no evidence, but its presence is possible. Control of rabies. Control of rabies. Urban canine rabies account for more than 96% of all human rabies. Control measure against canine rabies include stray dog control, vaccination of dog, quarantine of important animal, wildlife. Wildlife, this is much more difficult to control than canine rabies. However, there are ongoing trials in Europe where bat containing rabies vaccine is given to foxes. Success has been reported in Switzerland. Table first type of contact exposure and recommended post exposure prophylaxis. Table 2 wound management. Post exposure prophylaxis IM administration is an regime 1 IM dose of vaccine on day 037, 14 and 28. 5 dose 1 ml IM into deltoid or into anterolateral area of thigh children. 5 doses 5 visit RIG is always recommended for transdermal wound. Natural rabies infection in a domestic fowl, Gallus domesticus, a report from India. Significance. This case of naturally acquired rabies infection in a bird species, Gallus domesticus, being reported for the first time in India, was identified from an area which has a significant stray dog population and is highly endemic for canine rabies, indicate that spillover of infection even to an unusual host is possible in highly endemic area. Lack of any clinical sign and fewer opportunity for diagnostic laboratory testing of suspected rabies in bird may be the reason for disease in this species being undiagnosed and probably underreported. Butchering and handling of rabies virus infected poultry may pose a potential exposure risk. Survival after treatment of rabies with induction of coma. We report the survival of a 15-year-old girl in home clinical rabies developed 1 month after she was bitten by a bat. Treatment include induction of coma while a native immune response matured. Rabies vaccine was not administered. The patient was treated with ketamine, midazolam, ribavirin, and amantadine. Probable drug-related toxic effects include hemolysis, pancreatitis, acidosis, and hepatotoxicity. Lumbar puncture after 8 days showed an increased level of rabies antibody, and sedation was tapered. Paresis and sensory denervation then resolved. The patient was removed from isolation after 31 days and discharged to her home after 36 days. At nearly 5 months after he initially hospitalized, she was alert and communicative, but with chorioatherosis, dysarthria, and unsteady gait. Genagi's ketamine 2 mg per kg per hour, midazolam 1 to 3.5 mg per kg per hour, heparin 10 U per kg per hour. Oxygen optimized by blood transfusion maintain hemoglobin 10 gram per